Hello, and welcome to another episode of the AADI video series, Let's Talk About. My name is Julia. I'm the Asian Clinic Coordinator at Joslin's Asian American Diabetes Initiative. Spring weather is finally upon us here in Boston, and like many others, I'm sure we're all enjoying the longer days with sunlight. And with the warm weather, I'm seeing more people out and about, either enjoying a walk or even going for a jog, families with kids playing at the park. And for myself, I've been making a point to go outside for a walk when I log off at the end of the day. Just trying to get some steps in and move my body around because most of the day I'm just sitting in my chair all day long. Um, it's always on the back of my mind to set aside time for exercise, but I always feel too tired from work and I just haven't taken the time to sign up for a gym membership. For work, I'm happy to see more patients. They're coming back into clinic and get to chat with them a bit more after their medical appointments. But I also have a lot more online meetings. So by the time I'm done with a Zoom call at the end of the day, I feel even more tired once the week is over. It's also hard to believe that we have passed the 3-year mark since the start of COVID-19. And like many people, I think we're all feeling exhausted at this point, and not just physically, but also mentally as well. In our first 2 episodes, we talked about the physical and emotional stress of living with diabetes, COVID-19, and anti-Asian hate crimes. And we have gone through so much in a short period of time, and it's okay to admit that we're all exhausted or tired from this never-ending cycle. Today, I'm excited to welcome 2 guest experts to join me on the 4th episode of Let's Talk About, titled Moving Forward, Improve Your Balance and Mobility. I'm going to introduce Ms. Jacqueline Shahar. She's a clinical exercise physiologist and diabetes care and education specialist, and has been at the Joslin Diabetes for more than 20 years. She provides one-on-one consultation on exercise and diabetes, sports performance and nutrition, weight loss for people with prediabetes, type 1, and type 2 diabetes. Jackie, thank you so much for joining us today.
Hi, Julia. Thank you for inviting me. I'm excited to be here. You bring a very important topic here, connecting the body and mind. And what we know is that our brain and body are connected through neural pathways, along with neurotransmitters, hormones, and chemicals. So these pathways transmit signals between the body and the brain to control breathing, digestion, pain sensations, movement, and more. So when we exercise, our body releases chemicals called endorphins, and those are kind of interact with receptors in the brain to reduce perception of pain and make us feel better. There's also release of dopamine and adrenaline. And again, all of these going to be helping us with feeling happier, confident, feeling less anxiety and stress. And really, there is support of exercising that helps with the body mind connection, and being physically active is really good for our mind. So people notice reduce of stress, anxiety, reduce of feeling sadness or depression. Um, Exercise help with confidence and concentration. It also helps improve cognitive function. So cognitive function refers to activities like attention, memory, processing speed, executive function like problem solving and multitasking. So it's really important for us to be active to help us with our mind and improve all of those brain activities. And there's some research showing that people who are less active having more of a decline in their cognitive function than those people who are active. So it's very important for us to incorporate different activities into the routine: walking, hiking, swimming, dancing, tai chi, qigong, yoga. All of these are extremely important. But also it's important to keep in mind the intensity of the activity. So people who start exercising can start with a low intensity activity because maybe they're beginners and it's a little bit uncomfortable. But over time, we want to increase the intensity to be able to stimulate the release of those chemicals and hormones and work at more progressive, I guess I will refer to like a progressive overload. So for example, let's say if you walk 1 mile and it takes you about 25 minutes. So you're going to try over time, over the weeks, to go a little bit at a faster pace and maybe finish 1 mile in 24 minutes or maybe 23 minutes. If you are working with free weights and strengthening your arms, you work with 2 pounds, you want to maybe increase the number of repetitions or maybe transition to a 3 pounds or 4 pounds resistance, again, to stimulate the muscles and to help with that connection with the brain and the body and release of those hormones.
And Jackie, why is staying active so important for everyone and not just for people living with diabetes?
So physical activity and exercise are important for anyone because it helps slow down the aging process. It provides a whole body metabolic and systemic health benefits. There's so much benefit that exercise can bring. That's why regular exercise training is such a powerful tool. It can help with reducing the risk of developing obesity, insulin resistance, reduce the risk of developing type 2 diabetes, metabolic syndrome, cardiovascular disease, reduce the chance of mortality, and even more. Also, exercise improves, if we think about just acutely as people do their exercise and for the long term, it improves aerobic capacity, insulin sensitivity, glucose control, so many things that it's important for people with diabetes and those who want to prevent diabetes. It helps with increasing blood flow, fat oxidation. The muscles have the ability to utilize fat as a source of energy. It increases bone mineral density, increases muscle strength and endurance. Energy level increases, mood, posture. It also helps with weight loss and weight maintenance. And there's just a lot more than we can talk about the benefits. So it's really important. Also, what we want to keep in mind is part of that aging process, we lose muscle mass as we age, that refer to sarcopenia. And that process speeds up at age 50. But it's important to keep in mind that we want to preserve our muscle mass because the muscle is where we store up a lot of glucose. And that's where muscle is kind of the largest tissue in the human body. And it's critical for a place where glucose is being stored and utilized. So with training, we're going to be able to burn more glucose. So instead of the glucose circulating in the bloodstream, it's going into muscles. That's why we need to preserve our muscles or even try to increase our muscle mass. And that's important where resistant training, it's a key piece here that we want to incorporate to be able to preserve the muscle mass and increase the muscle mass so we have a good metabolism and we're constantly burning off the glucose even later on in our life as we age. And another very important component part of the aging process is that there's more risk of falls because of balance is decreased. So it's very important for us to incorporate physical activity and exercises to maintain our good balance and prevent the chance of falling.
I'm going to introduce Dr. Sally Ho. She is a doctor of physical therapy from the University of Southern California. She is an adjunct associate professor at the Division of Biokinesiology and Physical Therapy. She has a private practice and has been a physical therapist for more than 40 years. Dr. Ho treats patients with neurological, orthopedic conditions, and also those with geriatric challenges. Dr. Ho, thank you so much for joining us today.
Thank you, Julia, for inviting me. I'm happy to be here.
Jackie had discussed with us how it's important to listen to our body and our mind. What are some recommendations you have for when you see patients?
My biggest mantra philosophy is balance lifestyle, and also to empower the patient so they can take charge of their own journey. So the balance, let's start talking about that. Balance is about your posture. You balance your posture, you stand up tall, balance the front and the back and the left and the right. This is a physical aspect. However, balanced lifestyle also involved in balanced style is also involved in mental status. So we need to do good with our physical condition, and yet we also need to pay attention to our psychological health. And then another aspect I want to talk about is a balanced diet. A healthy diet is a balanced diet. So you cannot be choosy. You cannot be imbalanced with a lot of fatty food or sugary stuff. We do need to have a little bit of that, but we need to have a healthy diet for us to live a balanced lifestyle. And also, I like to talk about like a psychological aspect is the stress management. We all have stress. Lifestyle is very stressed, especially with COVID. Everybody's cramped in the small space and no communication, and that will feed into your tension, your stress. You may be clenching more, grinding more at night. That's going to cause TMJ problem. Your neck will be tense, your back will be tense, so that will feed into like a vicious cycle for your physical condition. So stress management is also very, very important. The other thing I want to say is we need to be having positive thought process. Okay, if you always staying negatively, things don't look good, and again feed into that vicious cycle that we don't want. Okay, a positive, healthy attitude can help you move forward. And then we also need to be active participation in our own well-being. We have the power. Doesn't matter how old you are, doesn't matter what kind of a health challenge you have. We need to take charge of the situation. I often tell my patient, don't let the pain say you are all the pains above you, condition above you, you're submerged underneath that. But you should really come back up, look at this condition and tell yourself, I am going to deal with this, then you can move forward. So I think empowering yourself, participating in your own well-being is really, really important. So my mantra is moving forward, okay? Regardless of your age, your health challenges, the stagnation, staying at one place and not doing any positive approach to move forward is going to lead to weakness and deterioration. So I hope everybody will be able to enjoy some of the video that I show you later on. It's going to be very simple, gentle, but it's good for you to adhere to it, and you can move on to a healthier life.
That's great to know that having effective and kind of positive thoughts and attitude can also be improving our physical state. And similar to how Jackie was emphasizing the importance of using our brain to recruit the right muscles to wake up, for myself, when I think of exercise, it's only physical things that I can think of, such as going to the gym or going for a jog. But I never thought about the way that even just thinking, keeping that positive mindset can also affect my overall being and not just only include like the physical exercise part. So Jackie had also discussed that in our bodies, we're quite asymmetrical, meaning that we tend to reach for things on our dominant side more often. So for me, I am right-handed, so I always reach for my phone, reach for my purse, pick up groceries with my right hand as well. So keeping all of these in mind, Dr. Ho has filmed some demonstration videos for us for different exercises. So we're now going to go ahead and play the clips of Dr. Ho's exercise video demonstrations.
This video, we're going to talk about our posture and our diaphragmatic breathing. So we start with standing up tall, thinking like a string suspending you from the top of the sky roof, okay? And you can do diaphragmatic breathing by holding your tummy out when you take a deep breath, okay? Breathe in and then blow out. Sucking your tummy, breathe in and blow out. Good. One more time, breathe in and blow out. When you blow out, you're tightening your core. This is our core exercise. I usually say this is our best friend. You have to carry with you all the time whenever you walk, when you think about it, you will be contracting your core, which will help you protect your back. Okay? This video is going to show you the flexibility exercise of the entire spine and your extremities. So we're going to start with good posture again, relaxation, breathing. We're going to do our neck exercise, which is forward and backward. As you were saying yes, you're nodding your head, forward as far as you can, backwards is halfway. And then you can turn your head side to side, to the left side, to the right side. As you were saying no, I'm shaking my head. And one more. And then the next one is tilting your head towards your shoulder. You won't be able to touch your shoulder, but just go towards that direction. This we call maybe, I don't care. So if you remember yes, no, and I don't care, you will remember this exercise. The next one is called chin tuck. So you're tucking your chin back, almost like you are doing a double chin. So on the side, you'll be seeing this way. So I'm stretching the back of my neck. The next one is it's called half moon. So you use the tip of your nose from one shoulder down up to the other in a relaxed manner. Whatever your neck would take you, just allow your head to turn and up. Okay, the last one for the neck is shrugging your shoulder. 1, 2, 3. And I don't need you to do forward because the lifestyle nowadays, everybody's slouching forward. So I don't want to focus on that. We're just going to do backward. After you do that, we can do the so-called chest mobility exercise, okay? You can be standing or sitting, whichever is safer and comfortable for you. So what you do is you bend forward, raise your arms up, take a deep breath, and then you bend forward, cross your arms in front of you. Breathe in, open up, and then you change your hand, the left in front of the right. One more time, breathe in, and blow out. Okay, after this, we're going to do side bend. Bending to the left and bending to the right. So we're moving our spine in different direction and our shoulder in different direction too. And you can think about expanding the right lung when you bend to the left side. And you're going to breathe into the left lung when you go to the right side. Okay, I think that's it.
So I would like to refer to the diaphragmatic breathing exercise that Dr. Ho demonstrate. This is a very important exercise that we should incorporate into our daily life. The diaphragm is a muscle that people tend to neglect, but it's something that is really important. It's a thin dome-shaped muscle that sits below the lungs and the heart. And it really helps with linking throughout the body. It provides kind of a network necessary for breathing. It has a lot of roles affecting the health of our body. The diaphragm has a role with neuromuscular training. So it's important for us for breathing, as I mentioned, to be able, so you want to be able to breathe. So exercising that muscle and practicing is very important. It can help with improving our endurance activities while inhaling through the nose and exhaling through the mouth. It helps with, when we inhale, it helps with expanding the rib cage and relax some of the muscles. When we exhale through the mouth, it helps with activating some of the core, deep core abdominal muscles. So it's very important. In addition, the diaphragm is essential for spinal stability. Part of the breathing exercises, the muscles are working to support the spine between contracting the abdominal muscles and relaxing the back muscles. So we want to train our brain to perform those dynamic movements with breathing and to contract the muscles to perform those activities. It's because our body function as a single unit rather than like segments. So it's very important for us to incorporate breathing, and we incorporate the breathing with the balance and contracting the muscles. We really getting to have like a powerful movements, and that's important to improve our quality of life.
We're going to talk about seated pelvic tilt now. When you're sitting, you're going to tilt your pelvis back. So you're going to rock back and blow out, okay? I'm going to show you on the sideways. So sit on the edge of the chair, you blow out, and then come back to neutral. You can blow out, tighten your tummy, rolling your pelvis back, and come up. This exercise will help you stretching your lower back, okay? And after this, we're going to perform sit to stand. So you will sit on the edge of the chair, put your feet behind your knees a little bit, and the procedure is to tighten your tummy, bend forward, and stand up. Okay, take a deep breath, and then blow out, bend forward, and sit down slowly. You're going to try it again, take a deep breath, and blow out as you bend forward and stand up. Bend forward and sit down. One more time. Bend forward, blow out, stand up. So you're training your hip glute muscles and your knee muscles. Bend forward and sit down. Okay, from here, we can move on to the bar exercise, which is very easy. You can use a counter, kitchen counter or bathroom counter, or on a sturdy chair. Okay, you're gonna do toe raises, heel raises, and you're gonna do simple small squat. Some people want to stick behind out. I don't really care, just relaxed manner. Okay, and then you're gonna do side swing, or I'll show you side swing. And you can go forward and backward. In this section, we're going to talk about balance. Balance is so important. The physical balance, okay, we talk about balance front and back, the postural balance, but now it's for the physical dynamic balance, okay? Because we don't want to fall. Once we fall, it causes a lot of problems like fracture shoulder, fracture hips, even hurting, damage your brain damage. Okay, so the simple things I like you to do is you can hold on to a counter again, or with both fingers or one finger, okay? You start with wide base of support. We can stand there for 20 seconds, 30 seconds, and feel stable and no swaying, okay? That means we accomplished this posture. And then we can go into the narrow base of support. Okay, if you're swaying, okay, not so stable, I'd much rather you hold on to something even with one finger, because I want your brain to have the stability stimulation. I don't want your brain to remember you're wobbly, okay? After that, you can do modified tandem stand, okay, meaning you separate your leg a little bit, and hopefully you can do again 20 seconds, 30 seconds. And then you can do the tandem stand. Same thing, I don't want you to sway. If you sway, you need to hold on to something, okay? And the next one, the last one, is you stand on single leg stand, okay? One leg, then the other leg. With the progression, if you pass the wide base of support, you can add some movement of the neck, nodding or turning. Same thing as every single aspect. If you have tandem stand, you do pretty good, then you can start with moving with your neck, moving side to side. Okay, so by practicing this every day, you're going to improve your balance.
Neuromuscular training refers to the capability of the nerves to send signals to the muscles to contract. So basically focusing on performing those specific exercises that train the nerves and the muscles to react and communicate. So for example, when we're squatting down to pick up an object, so muscles need to contract to support the body weight. When we balance on one foot, muscles contract to keep the body upright and stable. So the more muscle fibers and motor units that we recruit in the movement, the more powerful the movement is. So it's very important for us to train and incorporate breathing, sense the ground with different exercises to help us get more powerful movement. So without neuromuscular ability, it is difficult to balance and move and maintain stability through the joints of our body. So we want to think about how we can utilize muscles that are not firing, because sometimes there are muscles that are taking a nap or kind of not active as much. So we want to think about how do we contract those muscles. But the key is to contract them and incorporate the breathing with it. So if you, for example, like you don't utilize your glute muscles effectively when you take the stairs, or if you don't utilize the calf muscles when you walk or you run. So we need to kind of retune and sharpen those muscles that are taking a nap. So as an example, we can refer to exercise like step up. So stepping up, so simply you can stack a few books on the floor, and you can take a step up. You can start with your weaker leg. Also, I would recommend, if possible, for if it's in a safe area, for you to do it barefoot, so you can sense the ground. So your toes can sense the muscles, and your feet can sense the ground. So you have more stability. So you're going to be stepping up on stack of books, and then you step down. So initiate with your weaker leg. Also, you want to incorporate breathing as you step up. You're going to be breathing out through your mouth, and as you step down, you're going to breathe in through your nose. So this is where we actually start activating the diaphragm, that it's so critical here with stability, with posture, and recruiting those muscles and the breathing. Another exercise that we wanted to incorporate, refer to Dr. Ho's video, the single leg stand that she's doing, also can be done barefoot. And in addition, you actually can step on a pillow. So standing barefoot on a pillow makes the ground less balanced. And then again, we're sensing the ground, the muscles need to contract well to keep yourself balanced and secure. You can also incorporate some head movement as you stand on one foot. And again, I would encourage to start with a weaker foot and then go to the stronger foot. So then you're going to work on that muscle imbalance and try to be more in neutrality.
Now we're going to talk about some gentle strengthening exercise and cardio, okay? Strengthening exercise, you can use 1 pound, 2 pound, 3 or 5 pound. I don't like more than 5-6 pounds, okay? So you can use it what we were doing before. The chest mobility exercises, you can use the weight. You can use the weight this way, okay? Then you can use ankle weight on your leg. You can do your abduction, okay, and this one. You can swing back and forth. So it just adds some weight for you. And the next thing we're going to talk about is the cardio. Cardio is so important. It helps us strengthen our heart, our muscles. And I think you can do treadmill, you can do fast walk, you can do Tai Chi, you can do elliptical, whatever helps you improve your cardio workout is workable for you, then you should stay with that, okay? So I think this is all I want to share with you, and it's really important that if you can adhere to a strengthening program every day, work out a schedule for yourself, and you'll be enjoying the healthier life, okay? Move forward.
These video demonstrations are great, Dr. Ho. Is there any particular time of the day or how often do you recommend we do these exercises?
I would like to recommend twice a day if possible, but realistically, at least once a day. Okay. And the time could be, depends on the person, but I think ideally it would be one time in the morning, one time in the evening. If somehow you can carve out in your schedule and have a regular time that you're doing your exercises, then that will lead to a successful outcome.
I think it's very important that we all take a step back from our busy lives and focus on listening to our body and our minds. For myself, it's so easy to get caught up in the day-to-day activities and never really take a pause. Jackie, what do you suggest for those who feel too busy or even overwhelmed at the end of the day?
That's a very important question, Julia. So I think it's important for us to incorporate some activity into the day. We do want to keep in mind, as you mentioned, that you're very busy. So can you fit in short bouts of activity into the day? That would be very beneficial. The research shows that when people fit in short activities a few times a day, it can be very beneficial to improve glucose control, to see benefits with overall energy and feeling, and even with the mood. So I refer to call it exercise snacks. So when you fit in maybe 10 to 15 minutes of activity at your lunch break, that could be one option. So you're not sitting the whole time in front of the computer. Another option is to fit in some activity before dinner. So make sure you maybe eat a snack in the afternoon so you have the energy and you're not hungry. And then you can fit in maybe some yoga, or you can fit in some other activities using free weights. There's so many ways that we can be active. You have access to YouTube videos, and you can do a search for walking at home, maybe chair exercises, body weight exercises, Tai Chi, Qigong. All of these are great exercises that you can do, and you can find some really good quality videos on YouTube. And especially it works well if the weather is not great and you cannot go outside, then you can do some of the exercise at home. You can also consider walking indoors. Maybe you walk in the mall or in a big store. So those are kind of activities that we want to keep in mind. The key is that short bouts of activity can be extremely beneficial. It doesn't have to be significant duration all at once, because a lot of time people are very busy and it's hard for them to fit in exercise into the day. So lack of time is actually a major barrier for most people. So those short bouts, those short exercise snacks can be extremely beneficial to get good results and improve quality of life.
Jackie, I really like the way that you phrase how we can break up our exercise into little snacks and just kind of carve out time. Because for me, if, my doctor tells me, hey, you should exercise 30, 45 minutes a day, I'm like, I don't have 45 minutes to spare. But if you break it up and say, set aside 15 minutes for a walk, I'm like, okay, that is doable. I can step away from after a meeting, take a 15-minute walk, come back on again. So I really like that approach. And I think that, all of us, regardless of what we're doing throughout the day, can kind of carve out time that way as instead of like one whole block, which is great. Jackie, can you also touch upon how, overall, like what is the importance of the balance for everybody, right? Regardless if you're a young, healthy adult or if you're an older patient who might have trouble walking.
So physical balance is extremely important. You want to prevent falls and injuries. So good balance improves mobility and makes it easier to perform your daily activities and reduce those risks of falling and injuries. Maintaining balance requires coordination between the muscles, the tendons, the bones, the brain, ears, and eyes. And Dr. Ho presents some really good exercise that work on the coordination with the movement and the balance with doing the single leg stand, the tandem stand, incorporating some heel raises and chair squat. All of these can be great exercises that you want to incorporate into your routine. And we're going to be able to improve the balance as we practice on a daily basis.
And Jackie, during our past meeting, you had also mentioned that, a lot of times our bodies can be asymmetrical, meaning we might use one side of our body more than the other. What recommendations do you have for us to try to train, our non-dominant side of the body throughout the day?
So yeah, we want to keep in mind that our body is not symmetrical and it might create some muscle imbalance. If we cut our body to half, we're going to realize that our right side is more dominant. We have the liver, we have 3 lobes in the right side of the lung compared to 2 on the left side. The heart is on the left side. So our body is not dominant and is not balanced, sorry. And the right side is more dominant. And therefore, people tend to use their right hand more, their right leg more, and those muscles could be even a little bit more stronger than the left side. The left side could be a little bit weaker. It also referred to, I wanted to refer to our diaphragm. The diaphragm is an important muscle that sits below the rib cage, and that also not balanced. The right side of the diaphragm might be a little bit larger than the left side. And again, all of that create that muscle imbalance. And we want to think about how do we be more in neutrality by doing some exercise that also work on the left side. So working on, it's referred to unilateral training. So when we do exercises, we might start with only working on the left side first and then transition to the right side. So as an example, when Dr. Ho refers in her video, doing the single leg stand, maybe starting on the weaker side where you feel like your balance is not as good, or if you're doing, if you're taking steps, if you're going up the stairs, initiate with the weaker leg first. So these are all important things that we're not aware of, but they are can make an impact over time as you practice. We do want to keep in mind that some people are actually left-handed. So it might be a little bit different. So they might be more dominant on their left side. So they have to practice the weaker side as well. So it could be a little bit different. Yes.
And Jackie, for those living with diabetes, is there any specific or even extra advice that you would recommend to them before starting these exercises?
Yes, it's very important for us to check blood glucose with the activity. We want to see the impact of the exercise on the glucose. Some activities that we're going to incorporate may cause a drop immediately after the activity. Some other exercises might cause an increase in glucose. So we want to see the trend of what happened with different activities. Sometimes the glucose will be dropping later on. So checking the glucose before and after activity, or using a CGM, a continuous glucose monitoring, will be great. So we can track and figure out if we need to make adjustments with insulin, with oral meds. Maybe someone need to eat a snack to prevent a low blood glucose. Also, it's important to make sure that we stay hydrated during the activity, start hydrating even before activity. We also want to make sure that we're doing exercise that are safe for us. Maybe we have some stiffness in our body, different muscle groups, so we want to work on mobility and flexibility. If our balance is a little bit off, we want to focus on exercise that improve our balance. We want to work on endurance. So we basically want to incorporate different components into our exercise routine. Make sure to speak with your doctor about starting an exercise routine, and you can also refer to our exercise physiology department. So this is a service that is covered by insurance in most cases. So always check with your doctor or your insurance company to find out if the service is covered, and we can guide you through a whole exercise regimen and how to exercise safely, and give you some of those resources that you need to help with your glucose control, lose weight, improve overall your quality of life.
That brings a wrap to today's Let's Talk About episode. Once again, thank you to our 2 guest experts for joining me today. Jackie and Dr. Ho, thank you again.
Thank you, Julia.
Thank you for having me today. I hope you enjoy the stretching exercises and we can all move forward to a healthier life.